So as Emily mentioned, I am Kofoworola Williams. I'm a postdoc at Northwestern University, and I'm happy to be here. Hope everybody is healthy and safe. So today my talk is centered on improving access to digital mental health resources for Black men in college. And I'll be talking about two studies to illustrate this, centered on the themes of reach, relevancy, and relatability. So majority of my work, if not all, is dedicated to the Black men in my life. According to previous work in literature, Black men face unique challenges stemming from social and economic disparities rooted in race and racism. And as Black men enter college, stresses associated with that will compound with college stressors and emerging adulthood stressors, which can lead to an increased risk of anxiety and depressive symptoms. And unfortunately, these men are not utilizing services. And so that will lead to increased risk of dealing with these symptoms, poor social and academic outcomes, and eventually, potentially, an increased risk of suicide. And it's not that Black men don't want help. It's not that they don't know where to get help. It's really all about meeting them where they are and where they feel comfortable. So I like to think of this from improving access, which is why we're all here, right? We're talking about access. And for me, my work really focuses on access and thinking about it in the way like, what is the state or quality of these mental health resources being approachable to Black men? What are the means that they're going to use, the tools that they're going to access in order to engage with the mental health resources that we currently have in place? So the reality is that the quality, the means are not approachable to Black men for various reasons, and I'll just name a few drawbacks. So history. We're all familiar with history and how the unethical research practices towards Black people and Black men have created a medical mistrust and distrust that stems through generations and all the way down to generations today. If we're thinking about help seeking and how help seeking behaviors are negatively influenced by help seeking attitudes, which are influenced by social, behavioral, environmental factors such as masculine ideology, or more so a man's desire to conform to masculine ideology and to remain strong and not look weak. Medical mistrust, as I already mentioned, mental health stigma, and other factors. And then if we think about the delivery in which a lot of mental health services are provided, is face-to-face, in person, and due to the history, the help-seeking attitudes, and other social and environmental factors, traditional ways of delivering mental health services are not approachable or not interesting for Black men for the reasons I've already mentioned.
Hey, Kofo, sorry to interrupt. We can't see your slides, and I know that you have some awesome slides.
Here's the title again: Reach, Relevancy, and Relatability, Improving Access. We're here for it. Dedicated to the Black men in life, the unique stresses that they're dealing with, and working on improving access. We need to focus on these social, behavioral, and environmental factors and the drawbacks that must be attenuated before we can increase access and make them approachable to Black men. So improving access, working towards improving access, sorry about that delay. So in my work and the two studies I'm going to illustrate, I focused on three themes: reach, relevancy, and relatability. So with reach, I will say that reach is increased because, as we know, digital technologies and digital health tools offer increased access currently. Now, there are things we can do to further improve reach and promote reach and towards meeting Black men. And I think those ways are improving or promoting relevancy and relatability. So relevancy in the regards of, are these tools or these resources that we're going to bring to Black men able to fit, or do they naturally occur in the environments that they currently are in? Is it going to fit into the fabric of their everyday lives? Is it going to be relatable? Is it going to take into account the cultural and contextual environment that these Black men are in? So once we can do these and focus on reach, relevance, and relatability, I think we can really improve access to Black men for their mental health concerns. And in my work, I focus primarily on social media. So I'm obsessed with social media. I think it's powerful. I think it's popular. And according to publicly available data, we know that social media's access is there and the current use is high, such that more than 90% of US adults ages 18 to 29 are using at least one social media site. More than 65% of US adults who are Black are using social media platforms on a daily basis. However, even though it's increasing, it's popular, in the mental health literature, focusing primarily on digital tools and increasing the use or uptake of digital tools. That research is pretty limited and lacking clear evidence for the usefulness and acceptance among Black male college students. So I'm going to talk about two connected studies, and the guiding questions are as follows. Are Black male college students using social media? For what, how often? This study is more exploratory and descriptive. It's a secondary data analysis. And the other question being, are Black male college students interested in using social media on mobile-based apps for their mental health concerns? And that's qualitative inquiries, semi-structured interviews. The idea or the sense is that if we know their social media behaviors, the needs and their preferences and their acceptability, all that together will increase relevance and relatability of tools we could potentially create and furthering the reach towards these Black men for their mental health concerns. So the first study is a secondary data analysis. Like I mentioned, I utilized a data set from an on-campus ongoing study that has a whole bunch of surveys and questions specifically geared towards college students on a college campus. And they have data for anxiety and depressive symptoms, social media use questions. Are students using social media? Which platforms? Are they using it for social support, to seek advice? Are they using it to seek out any type of health information related to reproductive health, eating disorders, or emotional well-being and substance use? Again, it's descriptive, so descriptive analyses were conducted, man-Whitney U tests to compare use and linear regressions. So key findings start by the sample where the respondents, we had Black male students, white male students, Black female students, and white female students, and I compared their use of each platform, platforms such as Snapchat, Twitter, YouTube, Pinterest, Tumblr, and other social platforms, and then also focused on what is their frequency of use on specific platforms for social support concerns and for informational support. So key findings, main findings, at least the ones I'm going to touch on today, when comparing Black male students to Black female students, Black male students were using YouTube at significantly higher rates compared to their female counterparts. Comparing Black male students to white male students, Black male students were using Twitter at higher rates. And then if we look at Black male students to white women students, Twitter and YouTube were being used significantly higher among Black male students. So YouTube and Twitter are popular, we know that. Now, generally, just general use, Black male students are using Twitter. Among a sample of 89 students, about 57% of those individuals were using Twitter at least several times a day. 56% were using Instagram at least several times a day, 75% for Snapchat, and 62% of the individuals, Black male students, were using YouTube at least several times a day. Now, 20 to 25% for all four of those platforms range a bit for using social media specifically for social support. Again, that's for seeking out encouragement, emotional support, or maybe advice. And then for informational support or really information seeking about health topics associated with substance use and emotional well-being, Black male students are using those top four platforms ranging from 14 to 16% at least several times a day. So again, YouTube and Twitter is popular. We know they're using it. We know what they might be using it for. So we're going to contextualize these findings just a bit. And that is what I did with the qualitative inquiry, which were semi-structured interviews with Black male college students ages 18 to 35 from 2 universities in a large city in the Midwest. I focused on recruiting from specific specific student organizations that were geared specifically to minority students, and then also more generalized to the general student population and like department listservs and email platforms. Inclusion criteria: Black male students, they had to self-identify as Black or African American, be between the ages of 18 and 35, own a smartphone. It was conducted on Zoom. This did occur during the pandemic. The interview guide included questions about, are you using social media for mental health concerns? What would make you interested? How might you tell an individual about social media platform you might be using for your concerns? And we also had some questions similarly for mobile health technologies. Audio recorded, the sessions were audio recorded, and we conducted a thematic analysis. So key findings, start with the sample and what they look like. So I spoke to 11 men, very exciting conversations. I enjoyed myself very much. Spoke to 4 undergraduate students, 7 graduate students, averaging an age of 27. So what do these men say? The emerging themes were informational support, strategies, like what strategies are you currently doing to relieve your stress? And why would you use social media or mobile-based technologies, or why are you using these areas? So information and support mostly focused on how would you like to learn about resources for mental health on your campus, on social media. If you were using a platform, how might you disseminate information about the positives associated with this platform? As you can see, this young individual, if they were using a platform and enjoyed it, they might want to give their own experience concerning it in a way to connect with others and show support for others who might be dealing with mental health. Strategies were centered around watching videos to release stress. Going on social media was a good way to get their mind off of things. Individuals would also do things like keeping a calendar was common among a couple of students about how they like to have their stress relief and promote self-care. Reasons to use, on the other hand, were about social media being a good platform and outlet to bring awareness to mental health issues and possibly make the conversations about mental health a little more real, focus on eliminating stigma. 2 other themes that emerged were strategy support. So you already talked to us about strategy support, what you're doing to relieve your stress. How can social media or mobile-based technologies help you? An individual gave a great example about an interactive social media platform where you can post exercises for mental health, get facts about mental health, and then also create a forum or something, or a chat feature where people can talk across and support one another in that way and kind of do self-care together. Design considerations were very centered around aesthetics and how to promote relatability. And I don't want to say it's that simple. Excuse me, one second. It's not as simple as just saying to throw a Black man on a flyer or on a platform, but it very well might be in working and thinking about promoting relevance. If a Black male student can see a Black man who looks like them dealing with those issues, they're more likely to think it's relevant to them in a positive way. In conclusion, Black male students are using social media platforms, YouTube and Twitter specifically, at least several times a day. So when you're thinking about future work, when we might want to develop, let's say, social media mental health messages to support mental health symptom management and help-seeking behaviors among Black male students, we have an idea of where these messages can go. And I know there, at least in conversations with colleagues and in previous research, is worry about participant burden and how many times a day might we want to send notifications to students. Several times a day, maybe? We can think about that in conducting future work. Next step, if needs and preferences are addressed and incorporated in future work, it can improve racial relevance and draw men in. So needs, according to study findings, can be, or preferences, videos with minimal wording, videos or testimonials that include Black men as role models or modeling behavior. Some intervention component that includes interaction between peers and garners or promotes peer-to-peer support. And something that takes an individual's mind off of what they've been doing all day and what's been stressing them off, something that occupies them for a bit, offers them some positive social support and something funny and something joyous. Future work can work on how to best promote relevance and relatability using visual-based, text-based messages and components, and work with campus leaders, practitioners, and organizations, and utilize outlets that are already familiar to these students, and also partnering with Black male students and working on those, building that trust and rapport in that way. But also, it's important to include men in the work that we are going to create for them. That will also assist with improving or furthering reach, promoting relevancy and relatability. So where do we go from here? innovation with digital health technologies. I would say the reach is there. We should continue working on understanding the feasibility and future utility of digital health interventions and tools and social media, specifically for minority populations and specifically for Black male college students. Tailoring intervention components and interventions to their needs, their wants, their desires, and what is capable or what is accessible to them. How can we tailor these components and interventions to make them feel like they can approach these services, make them feel like it's relevant to them, and make them feel like it's approachable. I think also it'd be important that these future directions are adaptable for other minority populations. And of course, testing, figuring out if things can be scaled up and out. And again, focusing on the triple R, reach, relevancy, and relatability. So to wrap it up, I just want to thank everybody for listening, acknowledge the money that supports us in what we do. Dr. Emily Laddie, my primary mentor in her lab, Spit for Science Working Group, where the data set stems from, the Black male students who participated in the study, and to the current and future listeners and readers of this work. Thank you all for listening. Contact me here. I have a Twitter, and my apologies for the beginning and my cough attack. But everybody, again, thank you for listening.